Hello everyone, this video is on the equine limb anatomy and the different nerve blocks from a lameness perspective. Let's start from the hoof and move upwards. If we look at this x-ray, to the distal end we have the P3, also called as the pedal bone or the coffin bone. Above the P3 we have the P2, also called as the short pastern. And on the top of P2 we have the long pastern bone or P1. And finally, we have the navicular bone or the distal sesamoid located between the pedal bone and the deep digital flexor tendon. The location of the navicular bone is more clear in this picture. We can see that the deep digital flexor tendon seen attaching to the pedal bone is passing over the navicular bone. So here we have the P3 to the distal end and P2 just above it. The joint formed between both of them is called as the coffin joint, which is contained inside the hoof wall. The joint formed between P2 and P1 is called as the pastern joint. And here we have the fetlock joint, which is a joint formed between the P1 and the cannon bone. The cannon bone is otherwise called as the third metacarpal. It starts from the carpal joint above and ends at the fetlock joint. On either side of the cannon bone, on the lateral aspect, we have the lateral splint bone or the fourth metacarpal. And on the medial side, we have the second metacarpal or the medial splint bone. Now, let's see the major tendons and ligaments in this part of the limb that are important from a lameness perspective. The most outer one is the superficial digital flexor tendon. Just below that is a deep digital flexor tendon. As I mentioned earlier, this tendon runs all the way down to the foot over the navicular bone and attaches to the pedal bone. Thus, this tendon can potentially cause an inward rotation of the pedal bone. All the tendons and ligaments should be palpated in a flexed position for checking any rupture, swelling, sensitivity, or pain. So after the superficial digital flexor and the deep digital flexor, we have another really important structure called as a suspensory ligament or the interosseous muscle. This suspensory ligament is an integral part of the stay apparatus in horses, which helps the horses to sleep while standing up. Moving on, here we have the proximal sesamoid bones, and adjacent to the proximal sesamoid bones, we have a soft spot which can be easily palpated. This is the neurovascular bundle, and it can be palpated on both sides of the proximal sesamoid bones. This means that a vein, an artery, and a nerve is coming together as a bundle. So it is easy to palpate it mostly because of the pulsation of the artery and also because of the soft feel of the neurovascular bundle. Approximately 2 fingers above this neurovascular bundle is where the splint bone ends and forms the button of the splint bones. Now let's talk about the 4 major nerve blocks from a lameness perspective. Here, if you palpate a 1 centimeter caudal to the cartilage, we can palpate a neurovascular bundle here. The Palmar digital nerve block, also called as a heel block, is done here at this neurovascular bundle, medially and laterally. This desensitizes the caudal part of the hoof, the navicular bone, the navicular bursa, and the distal end of the deep digital flexor tendon. So after the local anesthetic, the bupivacaine injection, it desensitizes the pain and lameness associated with caudal heel. It desensitizes issues like navicular disease, fracture of the navicular bone, and even acute lameness caused by subsolar abscess, which can be caused by any penetrating foreign body. Please note that this will not desensitize the toe. It just desensitizes only the back side of the foot, the palmar 1/3 of the foot. Next one is the Abaxial sesamoid nerve block. It is done on the neurovascular bundle on both sides of the proximal sesamoid bones. This desensitizes the dorsal part of the foot, the toe, and the pastern joint. Thus, we can diagnose conditions like P3 fractures, cranial subsolar abscess, and most importantly, laminitis. Next one is a low 4-point block. It blocks the palmar metacarpal nerve just below the button of the splint bone and the palmar nerve as it runs down between the suspensory ligament and the deep digital flexor tendon at the same level. So this will desensitize the entire fetlock and structures distal to it. So we can detect osteoarthritis of the fetlock joint, tenosynovitis of the deep digital flexor tendon, articular fractures, and many other distal metacarpal problems. This is the high 4-point nerve block. So this blocks the palmar metacarpal nerve distal to the carpus and the palmar nerve between the deep digital flexor tendon and the suspensory ligament at the same level. So this will desensitize the entire metacarpals along with the fetlock joint and digits. So we can detect problems associated with carpo-metacarpal joint and problems associated with the cannon bone and the splint bones. The final one is the navicular bursa block. This is done to specifically localize the navicular lameness. So the injection needle with bupivacaine is inserted halfway along the distance of the coronary band. And so this one specifically blocks the structures inside the navicular bursa. So that's the end of our video. Thanks for watching. Bye bye.